Morning, everyone, and thank you for joining us. As you may know, I'm Tony from the Mercy St. Luke's Family Medicine Residency Program, and as we do the third Wednesday of each month, give a talk on a different medical topic. Today, we're going to talk about medication safety, and we have Dr. Kevin Zhang as well as Jason, who's a pharmacy resident with our residency program this month. And I think medication safety is a very important topic. And they're really just going to talk about how to properly take your medications. And I think in little things like, when to start medications, how to take them, when to stop them, little safety things like that, what to do with old expired medications, and just a lot of good information to be able to make sure that you're staying safe and well. So I'm going to turn it over to them, and we'll stick around in case you have any personal questions.
Alrighty, thank you, Tony. So we'll get started here. So my name is Kevin Zhang. I'm one of the second-year family medicine residents over at Mercy Health. So today our topic is going to be medication safety for older adults. We're going to be talking about tips for getting the most out of your medication, as well as special considerations that you might have to think about, like where to store your medication safely, how different medications might interact with each other, and side effects that medications may have that you should be aware of. So we got a couple pages of handouts here. We're primarily going to be reading and going over the first handout, which we've written, and then there's also a handout from the NIH, the National Institutes of Health, and the National Institutes on Aging, which are great federal government organizations that put a lot of great information. So I encourage you to look over that second page on your own time. So, so first thing we'll talk about are just the basics of medication. And I think some of these topics we often gloss over, both as patients and as physicians when we prescribe these medications. So when do you take your medication? Are your medications supposed to be taken at a specific time during the day with a specific meal like breakfast, lunch, or dinner, before you go to bed, things like that? How long are you supposed to be on this medication? Is it temporary, like just the antibiotic for infection you're dealing with, and then you're done with it? Or is it something you're probably going to be on for a long time, or maybe even indefinitely for the rest of your life, like your blood pressure medication or medication for your heart or your blood sugar, things like that? And what do you do if you miss a dose of medication? That's probably one of the most important considerations to think about. In general, it's always best to ask your doctor if you're unsure, but I would say in the case of most common medications, if you miss a dose, it's best just to start taking the next dose at the regularly scheduled time. You shouldn't try to double up on the next dose to make up for it, or things like that. The other thing is, if you accidentally take too much of a certain medication, it's always best to talk with your doctor to see if there's any especially handling that might need to be done, like any blood tests that might need to be drawn or something like that. Typically, most medications, if you take an extra dose, it's not going to be a huge deal, but again, something to talk to your doctor about just to make sure. And obviously, medications, like any consumable, you will eventually run out if you take them consistently. So you want to make sure you're in touch with your doctor and your pharmacy. If you need refills on your medication, make sure you're getting those before you take your last dose, so you're not stuck scrambling at the last minute trying to get in touch with your pharmacy after they're closed, trying to get a refill. Whenever you're starting a new medication, there's always things to think about, particularly side effects of the medication, as well as any interactions that may have with other medicines you might be taking. So a lot of common side effects we see with medications nausea, vomiting, for example, antibiotics are often notorious for causing diarrhea. Some medications might make you urinate more, like if you've heard of water pills, like Lasix. Those will cause you to go to the bathroom more. And usually, when you get prescribed a new medication, your doctor should be going over major side effects with you and any major risks to be aware of. Like, for example, blood thinners like Eliquis or Xarelto or Coumadin slash warfarin. Um, as you might expect, blood thinners will increase the risk of bleeding. So you want to make sure you're not at risk of falls or injuring yourself or anything like that. So those are just some things to think of. And in terms of interactions, so what do we mean by interactions? So interactions are basically if you're on two or more medications, some of those medications can basically combine together to cause unintended side effects or consequences that you might not expect or see from just one of those medications. And without going into too much excruciating detail, we see this sometimes with antidepressants or heart medication. Sometimes if you're on more than one heart or blood pressure medication, that can have negative effects for your blood pressure. It might make your blood pressure too low or make your heart beat slower than expected. So those are all things that you should be talking about with your doctor. And especially in the case where you may be on multiple medications prescribed by multiple different physicians, like your regular primary care doctor, and let's say also your cardiologist or your kidney doctor. You want to make sure everyone is on the same page. And generally, as physicians, we always, try our best to make sure we're talking to each other. But as the person taking those medications, obviously, we want to encourage you to be on top of what you're taking, and we would recommend anyone who's on a long list of medications to actually create a list of medications and always keep that up to date so that whenever there's changes, all of your physicians are on the same page. And again, interactions, one thing to be aware of, it may not just be interactions with other medications, they can be actually interactions with certain foods or dietary products, for example, alcohol, can cause some issues with antibiotics as well as other classes of medications. Certain food products may change the way your liver works, and that can also affect how effectively your body processes or metabolizes certain medications. And that is especially true with blood thinners as well. Again, Eliquis, Xarelto, Coumadin, Plavix, or clopidogrel, as known generically. Those are all things to think about. And actually, there are certain medications that should be avoided altogether if you have certain major organ problems like heart disease, kidney disease, liver disease. Again, these are things that your doctor hopefully should be aware of before considering prescribing a medication for you. But again, that's something you want to bring up every time you're being started on a new medication or if there's going to be a change in the dose of your medication. So I'll let Jason at the brand take over the next part of our talk, and he's going to talk about what we do when we start new medications as well as some other helpful tips.
Yeah, thank you, Dr. Zhang. So one of the key takeaways from our talk on medication safety today is really just wanting to make sure that people are comfortable asking questions when they're started on a new medication. We really just want to empower you to ask and encourage you at your doctor's visit, talk to them about what it's for, what should I expect, things like that. And then once you get home and you start taking a new medication, what should you do then? And so some of the things that we think about are keeping an up-to-date list of your medications. So if you start something new, make sure you keep it on a log and write it down. And then bring that to each of your visits. Sometimes you'll have specialist visits, you have a heart doctor versus a primary care doctor. Bring that with you to your visits, make sure that those doctors are aware that you've started a new medication or that you've stopped a new an old medication. Another thing is just to keep a date on the list of medications that you have, so, the lists aren't good if they're not kept up to date, and if they have, things that are old on there that you don't take anymore. And so just to help, the doctor provide the best, adjustments to your regimen and make treatment options available to you. Just write down the last time you updated it and keep track of that sort of thing. And then, that goes as well for when you're stopping a medication or if you're thinking about stopping a medication on your own. Just make sure you talk to your doctors and let them know whether you've decided to, or if you have questions about it. Try to understand the risks involved. So when you go to your next visit, ask, why do I still need to be taking this? How long should I be taking this? And, what are the signs, that I should be looking for to make sure that this medication is effective? Because, things like cholesterol medications, for example, you may not feel that you have a high cholesterol, so you think, well, I probably don't need this anymore. But if you go and talk to your doctor and ask them about, whether it makes sense to discontinue it, then they may be able to tell you, well, the benefit of this medication is actually long term, and so taking it over years, helps prevent heart events and things like that. So just really making sure that all of your healthcare providers are on board and aware of what you're doing, what you're taking, and things like that. And so that goes for prescription medications that you'd want to keep on a list, but also non-prescription medications. So anything you take at home over the counter for pain, that you get at the drugstore for, sleep aids or vitamins or supplements, or if someone's told you about something that helps with memory, for example, other, natural or herbal supplement, those can have some of those same drug interactions that Dr. Zhang was talking about, where some of them can actually interfere with the way that one of your medications works, or it can kind of make it last longer in your body. So we expect that once we take a medication, it does its job, and then you excrete it, you pee it out, or leaves your body a different way. And some supplements, if some of you may be familiar with St. John's wort, can be often used for things like depression. It's supposed to be a natural remedy, but it can actually make other medications stay in your body longer, and it can really kind of build up. And then we have risks of toxicity and worries about overdosing on certain medications. So just making sure your doctors are aware is really important. Something else that we talk about is just storage of medications. So that's not something that we cover at doctor's office visits or when you go to see the pharmacy, but sometimes they're really important storage considerations. So some insulin, pens or vials to be kept in the fridge, but once you open them, they can be kept at room temperature. Other things, just keeping your tablets stored in a place that's cool and dry and not affected by temperature. So if you keep your medications in like the medicine cabinet in your bathroom, for example, the shower really builds up humidity in the bathroom, and so that humidity really affects tablet medications and capsule medications that you take by mouth. And so sometimes those break down and you don't realize it, and then you keep taking it and it's not working. And then you go to your doctor's office and they make adjustments to your regimens based on medications that you're taking that aren't actually doing you any good. And so we try to keep that in mind when we think about where we're keeping our medications. Sometimes it's easier to remember them if they're on the bedside table or the kitchen counter, out of reach of little ones. If you have any young family members come over or pets, making sure that those are out of reach, but also kept in a place where you'll actually remember to take them. Use a pill box, so it can be really helpful to use to keep all of your days of the week medications individually kept in a box that helps you, remember, well, this one's marked as Tuesday and it's now Wednesday and there's still pills in this one. So let's have a look at mine. Not at all, come on in. Thanks for joining us. Just going over medication tips and storage, medication safety.
Yeah, it's very important.
Yeah, absolutely. So we're, talking about ways to keep them, stored safely where they're out of reach and, out of humidity, out of the bathroom, that sort of thing. And then, using pill boxes or pill organizers or setting an alarm on your phone to help, remember to take medications, things that way. And then other things that we also don't think about are like as needed medications, for example, that have expiration dates. And we think, well, I take this for my heart. If you have like a nitro pill or something that you take when you have heart pain, those do expire. And we generally think if it's unopened, you can go by the expiration date on the bottle. But if it's in one of your amber vials from your pharmacy, then it generally expires 1 year from the time you get it from the pharmacy. So, making sure that those are up to date, things like EpiPens, and other medications that you have on hand that are kind of old, those break down over time too, they become less effective. They're not well studied and once they're older, so we may not know if they're going to, cause you any harm if you do take it when it's expired. So just making sure that those are kept in date and being aware of the date on the bottle and looking at that and making sure that those are not expired before you take them. And really just, taking medications consistently. So, another thing that we do when we go to our doctor's offices is they have to make adjustments based on, readings like blood pressure and, blood labs and things like that. And so if they are making adjustments to your regimen based on medication that you're forgetting to take a few days a week or something like that, then, they may be making an inappropriate change to your regimen. So remembering to take them and then making sure that you note down if you don't, and then when you go to the doctor's office, letting them know, well, I did, forget to take this one, and that helps them make it more, appropriate treatment and safe treatment, change to your regimen. And lastly, I just wanted to cover disposal. So medication disposal is a huge one that, as more information comes out, as more research is done, we learn more things that we should and should not do with medication. So, for a long time, the instructions were to flush the medication down the toilet, but we know now that's not a good idea. It gets into the water supply and then goes out into the public. So we try to avoid flushing medications. So best case scenario, the best thing that you can do is, if you're able to take them to a sheriff's department or a police department, they have medication disposal boxes there. I think Wood County has them at 6 different police departments and sheriff departments. And, that would be the best way to get rid of medications that you're not taking anymore. Some pharmacies also take them back too. So if you have a home pharmacy, you can ask them, can I bring these back for disposal? Sometimes they'll take them. If they are controlled substances, so like opioid pain medications, some anti-anxiety medications like benzodiazepines, anything regulated by the DEA, they have to be disposed of in a certain way. So sometimes the community will have take back programs like the sheriff's department will often have like a yearly take back program to accept medications for disposal that way, so that they can be done, legally and appropriately. They can be kept out of the wrong hands and, anybody going through the garbage, things like that. Now, if you're not out and about, and if it's, very cold weather like it is today, it's negative temperatures, we don't want to go out and get rid of something, but we don't want it in the house either. We can put it in, kitty litter or, coffee grounds, things like that. Mix it in really well, so that the tablets or capsules or whatever the medication it is, not appetizing for someone who might be going through the garbage or something like that. So yeah, just making sure that we're disposing of them properly, and keeping things on hand that we're taking, and only those. That is everything for us. Any questions today?
Like it, we took care of all. You're very thoroughly done, and that's very good.
Thank you, I appreciate that.
Right, thank you.
Yeah. So what is actually your title, if I may?
Yeah.